Let's begin. Hi, everyone. Welcome to today's Mental Health and Wellbeing Introduction Workshop. Thanks so much for joining. So my name's Shanika, and I'll be co-facilitating this introductory session at the beginning, along with a couple of other people. So let's get stuck into it while we wait for a few other people to join. This session will be not only informative, but it should be quite interactive as well. So feel free to contribute your thoughts, your wisdom. If you are comfortable to, we'd love to see your faces as well. So yeah, let's get into it. Now, before we start, we'll just begin with an acknowledgement to country, just acknowledging the traditional custodians of this land and acknowledging the privilege to hold space and go through this content. Yeah, so just a real acknowledgement there. Following on from that, I know a lot of you here are very familiar with the work that we do here at ShareTree, and perhaps you need no reminder, but I can see some fresh faces here as well. Really, our purpose is to inspire authentic connections where both performance and well-being can thrive together. It's a really unique perspective, and sometimes people believe that well-being doesn't belong in the conversation around performance, but our research and our findings actually show it's the complete opposite. When we prioritize well-being, performance thrives, and vice versa. So we are a social purpose ecosystem. We work with businesses, community organizations, schools, families. We're a fully registered charity, and we're also certified with Social Traders and an official partner with Mental Health Foundation Australia. We're quite a unique model. We're here to pioneer charity as a service. Instead of relying on donations from the community, we deliver a really valuable service. And in doing so, we funnel the profits towards community projects in schools and families as well. A little bit about myself to begin with. My name is Shanika Jayakody. I have quite a diverse background. From a background in entrepreneurship, I have been an entrepreneur for the last 12 years. I have my own enterprise called With Purpose. It's a social enterprise. I also lead all the schools work that we do here at ShareTree. I am personally a certified mental health first responder, which is what this workshop today leads into. I really do a lot of work around facilitation, character, and culture. And that's the work I've been doing for the last 11 years, mostly in guiding and mentoring medical students, using a lot of the frameworks we're going to go through today. My passion in mental health is really around my own experience. 6 years ago, I lost my brother to suicide, and that really turned my attention to just how important it is to prioritize well-being and just how important it is to be aware and have skills and frameworks in place, not just in workplaces, but in our personal lives as well. Now, this workshop, this first introductory workshop, is really an introduction to mental health and well-being. And this is a 1-hour session, which is going to be followed by our mental health first responder lift practice session. This session itself is really about bringing awareness to the statistics around mental health, becoming really aware on the psychosocial risk legislation, having a real insight into the trends, how we measure mental health and creating effective frameworks, support networks, and being able to actually validate the impact of the work that we do. After this first session is done with me and Brianna, Reese is going to take us through the lift practice. And this is the first session of the certified mental health first responder training. You're welcome to hang around for that session afterwards, but this is really where we talk about what is a mental health first responder. How do they support people in distress? And he'll really give you an enlightening experience around the LIFT framework, which is a core aspect of mental health first responder training. Followed from that, if you wish to continue with it, we have the second session It won't be today, it'll be in a few weeks' time, which is called the ACT practice. That's all around de-escalating emotion, assessing risk, collaborating on support plans, taking time to check in, and creating care and well-being plans with preventative frameworks. Mental health first aid is a great program that complements the work we do here, and a lot of you would be very familiar with that as well. And that's specifically focused on supporting mental health issues in real times of crisis. Okay, now just a small notice, the content we're going to be going through here is reasonably light, but just in case, if you feel any of the topics that we go through today trigger anything in you and you feel it's too personal for you, it's really important that you take a break, or you even potentially withdraw from this session. You speak to someone you trust, and if need be, you contact the Mental Health Foundation or Lifeline. Again, the content we're going to go through is reasonably light, but just so you're aware. So the first part of this introductory workshop is actually going to be facilitated by Brianna Catanach. She's the National Manager of Mental Health Strategy and Delivery at Allianz. She is a registered senior occupational therapist, a key committee member and special interest group conveyor with OT Australia. She lectures at Swinburne and La Trobe University, and she's an academic advisory committee member. And so, Brianna, I will leave it to you to take it away to go through the workplace realignment strategy from Allianz.
Thank you so much for the very warm welcome, and it's lovely to be here with you all this afternoon. So for those who aren't familiar with Allianz, just very quickly, we are one of the workers' compensation insurers that workplaces across Australia may use to help ensure that they have a level of support in place should their workers become injured, both physically or psychologically. And what this essentially means is that we have a couple of really key roles. We work really closely with the national safety regulators to understand what their requirements are in terms of creating safe workplaces, and we become a bit of a conduit and a partner in then translating that information to our clients, looking at their claims and what might be going on that's causing injuries within their workplace, and then looking to build strategies at either an industry or a client level to try and prevent those injuries from occurring in the first instance. Where, however, there is an injury, our second role is to provide support and case management to Australians who are injured through the course of their work and help them with their recovery, their return to work, and their return to health. And through all of that work, a really key focus is, of course, on mental health and mental injuries. And so the ShareTree team have very kindly asked me to come and speak to you all today a little around what's specifically going on in the workplace space, what's some of the data and what's some of the research that Allianz have recently been able to sort of share in regard to trends in this space. And also, really importantly, what are some of the really practical strategies that workplaces can implement, and what are some of the growing requirements for them from a work health and safety legislative perspective. So if I can just get you to move to the next slide, Shanaka, please. So I thought I'd start by painting a little bit of a picture for you all. And I think it's not going to surprise anyone on this call that mental health is increasingly impacting our communities, our family groups, but it's absolutely impacting workplaces really significantly as well. Some of the most recent data that's coming out has suggested that 91% of workers have been exposed to work-related stress in the last 12 months. And that of those workers, about 60% have experienced symptoms of a mental health condition in the last year as well. Now, that doesn't necessarily mean that they have a clinical diagnosis, but it definitely means that aspects of their work are causing them to have low mood experiences, are causing them to have ruminating thoughts and excessive worry, are causing them to have interrupted sleep at night, low motivation, reduced energy, and a whole range of other experiences that first and foremost just make both work and life a little less enjoyable, but also definitely create a greater level of vulnerability for going on to develop clinical diagnosable mental health conditions and the sorts of experiences that the team at ShareTree are going to speak to you around. This impact on mental health is also creating a really significant burden to Australian workplaces and the Australian economy at a financial level. We estimate that the cost of mental ill health is around about $60 billion in any given year across both Australian government, business, and then also to individuals. And around about 12.8 billion of that can be aligned specifically to the impacts within workplaces. So that is a really significant direct cost to Australian businesses and Australian workplaces that could be so much better spent on protective, positive programs, on increasing, staff rewards and benefits, on creating additional roles within organisations. But at the moment, we see that the majority of that 12.8 billion is lost through absenteeism. And for depression alone, there's around about 6 million working days that are lost each year in Australia from employees not being able to work. We also know that there's a huge productivity impact. Absenteeism alone equates to about 5.6 billion of that overall 12.8, but that doesn't account for things that can be a lot more challenging to measure, like presenteeism, where people turn up to work and they're physically there in body, but they are not there and switched on in mind. It also doesn't allow us to really clearly look at the link between poor mental health and physical workplace injuries, and the fact that we know people are more at risk of being involved in a workplace incident, a manual handling incident, a car accident, driving incident, when they're experiencing depression and anxiety. So there are huge flow-on effects to the fact that within the workplace, people are stressed, and within life at the moment, they're also definitely feeling it. Not only do we see direct cost implications to businesses, though, we also know that more and more workers are looking for workplaces where they feel safe and where they feel well, which is absolutely a fair and reasonable expectation. And as a result, we are seeing more and more people who are selecting their employer based on how well they believe that workplace will support and cater to their mental health needs. And in some really recent evidence, about 75% of Gen Z and 50% of millennial workers have reported that they have previously left a working role because of mental health reasons caused by that workplace. And that of the various reasons that might be impacting, so it could be, poor workplace relationships, bullying and harassment, all sorts of things, burnout in particular makes people 6 times more likely to want to quit their job. And so it's because of all of these sorts of combining factors that we're also seeing across workplaces in Australia really significantly increasing regulatory pressure and a shift away from expecting individual workers to manage their own mental health, to be turning up to work fit for work and leaving, any personal issues at the door. There's been this real shift to actually requiring workplaces to proactively look after the mental health and well-being of their people, and to really take a preventative approach in the workplace of looking at how your people are working, how they're engaging, and what can you do to make sure that is as psychologically safe and psychologically supportive as possible. So if I can just get us across the next slide, and we'll only pause here for a moment. So what this regulatory pressure has meant within workplaces is that we are increasingly seeing new legislation passing around what the obligations of workplaces are in respect to managing psychosocial hazards and risks. So essentially those aspects of work that might negatively compromise someone's mental health. I'm not going to go through these tables in innate detail for you, but here you've got a range of the states, and on the next slide you've got the remainder, just outlining where they're at in the legislative process of implementing really specific mental health legislation for their states. In a nutshell, with the exception of Victoria, every state has now implemented specific legislation that requires workplaces be much more proactive in managing psychosocial risks. And Victoria is absolutely on that journey. They have draft legislation that's gone out to consultation. They were actually the first ones to introduce the draft legislation. They are ironically going to be the last ones to pass it. But what we can say is that fairly soon nationally, this will be an expectation. And what I've provided in this pack is the sort of direct hyperlinks to both that legislation, but also the really practical resource hubs that each of the state and territory safety authorities provide in that second column of those tables. So, what does this legislation actually mean for workplaces? Well, if we flick across to the following slide, in a nutshell, it's asking workplaces to do four key things. And this is absolutely no different than what workplaces have been expected to do when it comes to managing physical safety in their workplaces for decades now. We're just asking them to bring an equivalent approach to psychological safety, which absolutely can be a little bit more challenging because it's less visible. We're not talking about a clear trip hazard. We're not talking about a physically heavy task or a manual handling task that's unsafe that we can see. We're talking about these more work experience, job design, cultural relationship factors that are a little bit more challenging to contextualize but have equally as much potential risk and impact. And so at kind of the highest point, and I would say if anyone's really interested in this, great starting point is to go and have a look at the Safe Work Australia Managing Psychosocial Hazards at Work Code of Practice, which is a bit of a mouthful, but it is linked on the previous slides. And really understand what that is asking of workplaces. And it comes down to four key actions, as I said. First one is for workplaces to actually understand what sorts of elements of their workplace can be challenging or risky for their employees. So to identify psychosocial hazards. They then need to conduct a risk assessment and look at how likely is that hazard to actually cause an impact for people, how severe would that impact be, what are the potential control measures, what are the sorts of things that they could do to eliminate or change or support people with respect to that hazard. And these hazards are really wide and varied. They can be things from too great or too low a workload, a lack of role clarity, bullying and harassment, occupational violence and aggression, exposure to traumatic content, right through to really sort of fundamental things like the way people's job is designed, how much control they have over their day-to-day work and their schedules and things. And so once we identify and assess those risks, the next step is to then take some practical steps and make sure that workplaces, as they recognize the things that can put people at risk in their workplace, also go that next measure of putting in place controls or strategies or interventions that reduce that risk and create a safe environment for their people. And then the final piece is that, just the same as with physical safety, these kind of approaches can't be done just purely by a safety manager or a business owner. They need to be done in consultation and collaboration with the workforce. So we need to seek feedback. We need to check in that these sorts of approaches are working. There needs to be a clear review process, and there also needs to be an improvement process as well. So that if we're finding one of these strategies is not quite hitting the mark, we've got some fairly good and immediate feedback and data, and we're able to be flexible and agile in our approach. The other thing that we're now seeing workplaces needing to do is demonstrate in the exact same hierarchy of risk management approach that we've had in place for years for physical injuries, that they're thinking really critically around that psychosocial risk assessment and control process. And that means that those five key steps down the right-hand side of the page are being considered in your risk management strategy. So that we're asking workplaces to think first and foremost, if you have psychological hazards present, let's take a really kind of obvious, visible one like occupational violence and aggression. First and foremost, how can you eliminate that experience altogether from your workplace? And there's absolutely some steps we can take to eliminate occupational violence and aggression. We can look at environmental measures that create barriers and boundaries for safety. We can look at clear messaging and contracts of behavior with the people that we engage with. We can look at, being more selective with who we engage with in our workplaces. But the reality is that's only going to go so far, because there are plenty of workplaces where we can't eliminate and control the behaviors of others. Public health is a great example of that. You have very vulnerable people coming into emergency departments. We can't choose not to service them just because they pose a risk. So the next step is workplaces need to think about what can they do to substitute elements of that task to make their people safer. And in substitution, it might be saying, okay, well, this part of the task is particularly risky. So it might be doing that intake process is quite risky. We know that lots of incidents happen with the reception staff, with people that come into an emergency department and are really heightened. So can we turn that into an electronic form? so that it requires less direct face-to-face contact. Our people aren't having to work as closely with potentially risky individuals. And again, maybe we can substitute some of that work, but you can't have a robot come along and give person-centered care. At the moment, we definitely don't have the capacity to do things like vitals or observations or blood tests or a whole heap of these medical tasks by remote access. So again, it's not always practical to substitute these tasks. So then we need to think about, well, can we redesign the tasks? Can we approach them in a different way that might minimize some of that risk? Instead of having one person undertake the task, do we send two people in? So there's that secondary safety approach that if someone is escalating, we've got one person there dedicated to managing behavior, one person dedicated to undertaking the medical task. Can we look at how and when we put the tasks in order? So maybe if we know that taking bloods is often a task that sparks people up and then that impacts the interaction going forward, do we move that to be the very last task that we complete? So if it does go poorly, all of the other things have been done in a safer way. And again, big ticks in lots of instances, but in some instances in healthcare, as an example, bloods have to come first because we don't know what other tests we need. We don't know what other things we need till we get that information back. So if we can't redesign tasks, then we drop into the idea of educating. Can we train our staff to respond better, to practice in a safer way? Can we build their resilience and coping strategies? And that's often a really good support to all of these other sorts of things. And then the final piece is encourage. What can we do to encourage behavior change and encourage improved self-care, both with respect to the people we're supporting? So that might be more signage, that might be really clear expectations of people coming into the workplace. But it also will be around how do we encourage our staff to look after themselves, offering employee assistance programs, offering debriefing after challenging incidents, having programs like the psychological first aid in place so that we have staff members that can respond when someone might have been impacted. And so you can see that there's this really increasing safety approach, which we've seen for all sorts of tasks, but now has to be taken to that mental health space. So I don't know if anyone had any questions before we sort of jump into a little bit why this has happened and what we might be able to do in workplaces. If not, we can just roll on to the next slide. So beyond the kind of community impact of mental health that I've been speaking to and beyond sort of the broader workplace impacts, a big part of the reason that nationally the safety regulators have introduced this legislation is because we have seen a really strong trend over absolutely the last 5 years, but realistically about the last decade or so, of increasing workers' compensation claims and increasing costs, which means that more and more Australians are not just being stressed at work and not just not enjoying work or leaving workplaces that aren't very good for them, but they're actually being psychologically injured through the course of their work. And what we've seen in the last 5 years, so between 2019 and 2023, is around about a 46.6% increase in the rate of mental injury claims altogether. So significantly more people are experiencing these injuries than ever before. We also know that the complexity of these claims is much more challenging to support and manage than when someone experiences a physical injury. And as a result, we tend to see a lot more time loss. In fact, on average, people will be out of work for around about 69 days when they experience a mental injury. That's actually a really significant period of time not to be working, when we know that work does things like provide really good routine, provide great support networks, give you a sense of purpose and those sorts of really important elements of our well-being. We also know that when these claims occur, they're really expensive. On average, they're about 36.4% more expensive than physical claims. And we know that the most common causes for these claims are elements of those psychosocial risk factors I was speaking to before. Most significantly, interpersonal issues, so breakdown in relationships between managers and workers or co-workers. Sometimes this also gets classified as harassment, and then also workplace stress. So Allianz being in this space very acutely, if I can just move to the next slide, are really keen to understand more and more, like, what is causing this? What's happening in workplaces that isn't quite working for workers? Why have all of the fantastic programs that existed over the last 5-10 years not had the impact that we necessarily expected them to do? And so what we've been doing since 2019 is a really extensive research study of exactly what's going on in Australian workplaces, what's fueling workplace stress, what's leading to workplace injuries, and why are workplaces in Australia continuing to have challenges in the way they support people, and what could they be doing differently. And so this year for 2023, if I can just get you to move the slide again, the first year that we've kind of seen a real kind of clarity and a bit of space since COVID. For the years before that, so 2020 through to 2022, we were getting lots of reports about these after effects of COVID. And I don't think that's necessarily entirely gone away, but definitely the focus has shifted for workplaces and workers more generally. And what we found with this year's research that just got released last month, so this is really current, really relevant to workplaces, is that fatigue and burnout are by far the most challenging issues for Australian workers at the moment. 2 in 5 employees report that they are currently experiencing genuine and impactful symptoms of fatigue and burnout, and that this is negatively impacting their job satisfaction, their productivity, their home life, all sorts of things. That is then being compounded by things that are going on outside the workplace, particularly financial pressures and the sort of uncertainty that there is within the economic climate at the moment. And 35% of employees have stated that they think cost of living is actually impacting them even more than fatigue and burnout. And that is, again, really negatively impacting their job satisfaction. So that is worries about things happening outside of the workplace that are then flowing into how you feel about work and how you feel about the way you're being rewarded, the way that you're being paid, whether you're getting value out of that work experience. We also know that a lot of employees are feeling it at the moment. At least 2 in 5 are starting to experience symptoms of fatigue and burnout, yet only 31% are likely to put their hand up and ask for help. And a big part of that challenge is that 41% of workers don't feel that they will get an appropriate response from their manager when they do ask for help. They don't think it will be received in an empathetic and intelligent way. And that's why programs like the psychological first aid are so important, because they help to bridge some of that gap. We also know that there is a bit of a disconnect between employees and managers at the moment as well. 60% of managers believe that their organisation is going above and beyond, doing everything they possibly could be to be creating these mentally healthy workplaces. But 67% of employees do not agree. So there is this increasing disconnect between the experience of managers in workplaces and the experience of their workers. A big part of that has to do with this idea of work-life well-being and balancing work and home duties, particularly for those who are working in hybrid or work-from-home models. And we've seen a real increase in this space with about 30% of employees reporting that they just feel like they work too much, that they spend far too much time engaged in work, thinking about work, that they can't switch off, and that work is encroaching more and more upon their life and their personal time. And all of these factors are then leading increasingly to turnover risks. And in our most recent data, we found that 41% of employees are likely to consider leaving their current organisation in the next 6 to 12 months. That would mean 1.4 million Australians out there leaving organisations, seeking new roles. So that would be incredibly disruptive to businesses and would then have flow-on effects to the mental health and wellbeing of everyone else within those teams as well. So what can we do about this? There are a few really key things, and there are 4 areas that our research suggests are most important to focus on at the moment. First and foremost, it's having more important conversations within workplaces. And again, psychological first aid training is such a good way to help achieve that. So big ticks for this program. But we know that more and more we need to create these support networks within workplaces. And more people are looking to their workplace to actually be providing mental health education, a space where they can go and have conversations, a space where they can seek help and support. So we need teams and team members and people across our organisations who are upskilled to have those conversations, who can provide peer support, and we need regular check-in systems in our workplaces so that people have a way of actually prompting these conversations and have a pathway to ask for help when they need it. For individuals, that means that we also need to really be accountable for seeking feedback from others, for asking for help when we need it, and for building those support networks within the workplace. It has to go both ways. The second thing we know needs to be an absolute focus to address this trend is increasing the capability of our leaders, and not so much in their organizational, operational, clinical, whatever it may be, tasks, but in their capability to lead, to be a manager and a good manager. We need to see things like communication training, emotional intelligence training. We need to see leaders who are able to offer programs that address both career but also life for their employees. We need to see them planning for both of those sorts of experiences. And we need to see them as actually delivering some wellbeing education and resources. We know that for individuals in workplaces, they consistently report the person they want to engage with on this topic more than anyone else is their leader. They don't want a whole heap of external consultants always coming in. They don't want to hear from HR. They want their own manager to share some of this information with them. And so for employees, it means we need them to be seeking more transparency in what's next for them and what their career is, but we also need them to be engaging really well in that mentorship and training. We know as well this hybrid flexible work is great in some respects, but can actually be really compromising of mental health if we don't get it right. And so again, we need to make sure that we are doing things to manage good work, that there is workload visibility, that there is connection within the workplace, that we are planning for peak workloads and we're getting the right supports and the right structures in place, that we're designing work to be good for people. And for individuals, we need to be a little bit more flexible. We need to set and respect clear expectations around flexible work. That means we're being flexible about our own work, but we're also respecting others. We need to implement more work-home buffers and create that space between working and being at home and being able to actually switch off from work. And really importantly, we need to make sure that connection is still a really key focus as well within our workplaces, that when we go to work, we are turning up, we are there for our colleagues, we are connected to our teams, we are collaborating. And then the final piece is that we know that with the economic pressures, people are feeling it at the moment. Doesn't mean that everyone can get a pay rise. That actually wouldn't help the economic situation, unfortunately. But we know that there are other ways to make people feel rewarded and secure in their work. So we need workplaces to be offering more really meaningful reward systems in their workplace. It doesn't have to be monetary. It can be about opportunities in the workplace. It can be about social activities within teams. It can be about throwing a lunch for people. But we need to see more of that. We also need to see more opportunities for people to be collaborating and to be really understanding the impact and the meaning that their work has. We know that when people have a sense that their work is making a difference, that actually significantly improves mental health. From an individual level, it also means we need people to be buying into these systems, to be planning long-term careers with their employer, to be using their own reward system. So when they are working from home, they've set things up so that after 2 or 3 hours of focused work, they get a Mars bar at the end, or they have these other systems in place that make them feel good about the work that they're doing. And really importantly, we need people to be using their leave, taking a break, being able to step away from work, being able to get some of that personal reward and recognition by going and spending time dedicated to your family, or going and doing something that makes you feel really good. And so these are the sorts of strategies and toolboxes and resources that will be increasingly building out for workplaces. I don't think it's anything necessarily brand new. There's little bits and pieces in here that are a bit different. But what I think it is going back and getting the basics right and building capable teams, capable leaders, creating that work-life balance and making sure that people are feeling really well regarded, recognized, rewarded, and secure in the roles that they have. So that's a little bit of sort of why we see programs like psychological first aid as being so essential, because they fit directly into that strategy. They respond really directly to the legislation, but also very much to the way that we are seeing workers wanting more from their workplaces. And so I hope you really enjoy the rest of today's session. If you are wanting to get a copy of that research, see some of the resources we have available, get your hands on that data, the QR code on your screen at the moment will take you directly to the website. And otherwise, thank you so very much for having me tonight. I hope that's kind of given a bit of a foundation as to sort of how this space plays into so many other parts of our lives.
Cool. Thank you so much, Brianna. That was such an insightful presentation, and it's really useful to actually see the numbers behind what you intuitively can feel is taking place in the world. Yeah, that was really interesting. So I'm just going to go through the rest of this first introductory session before we move on to the LIFT training, which is part of the mental health first responder training itself. And really tacking on to the great body of research that Brianna just presented, the government framework around mental health is a framework called PPEI. And so what that stands for is promotion, prevention, early intervention, and skilled support. So promotion is about building individual, collective emotional awareness. Very similar to the framework Brianna went through, and it's all about actually establishing a culture where there's trust and there's support. You want to know that if you speak up at your workplace, that you can trust the people you speak to, because when it comes to mental health, what we're sharing are truly vulnerable things. So establishing a culture that actually embeds that level of trust and support is what promotion is all about. Prevention is really important as well. If we can take preventative measures to instill good frameworks of mental health, then that's a huge part of the solution to this issue. Confidential routine check-ins, mental health education and well-being plans, these are all parts of what we want to see in workplaces becoming basically a base standard as across the industry. When there is a challenge in mental health, and to a large degree that's inevitable, what we want to know is that we have the ability to have early intervention. We want to know that there are people who are skilled and certified who can respond to these challenges. And as a leader, you know you can trust your mental health first responders and aiders to guide those situations. So we recommend a ratio of at least 1 in 10. 1 in 10 people in teams who are skilled and qualified at tackling and handling those issues. And to be able to provide immediate strategic support for people who are in distress or are at risk. Lastly, skilled support as well. We don't want everything to be done in-house. Some challenges require skilled and trained professional support. And what's really important is that it's integrated. It's integrated into the workplace, so it's accessible, it's recognized as a normal solution. And so this includes EAP programs, professional services, community support groups, and we want to see more promotion of this skilled support in the workplaces as well. Now, it's now very clear that skilled support is an integral part of the PPEI framework that was initially promoted by our government. Now, mental health first aid is really valuable, especially in that last stage of this journey where someone needs skilled support in particular. They need to be directed to the right channels. And that's exactly where mental health first aid comes into the equation. Most of the time, a lot of the mental health challenges actually arise before this. And so that's where mental health first responder training really thrives. It's around building a culture of psychological safety. It's around building a culture of trust and support and actually creating the frameworks of prevention and early intervention. And so what we're going to go through today is really those early stages of the mental health journey. Now, as part of the preparation for this workshop, we sent out a form for a mental health and psychosocial risk organizational self-assessment. I know a lot of you have completed that. And if you haven't, we'll resend the link to that form again, and you'll get basically a report which gives you a really good indicator of the risks in your organization that you can then create strategies around. So this assessment is really designed to give a really clear assessment of the current state of mental health practices and frameworks in your organization. And we've done this using the official recommended frameworks of promotion, prevention, early intervention, skilled support, but we've added advocacy as well. So it's going to give you a really clear idea as to how strong the culture actually is around mental health support, but also from a solutions perspective, what are the steps that you can take to improve that culture? So when you complete this psychosocial risk assessment, you'll get a report that looks like this. I'm going to spend a little bit of time really just explaining what this report is and how it works, because it can be a little bit confusing when you first look at it. So this assessment contains a whole heap of questions, like the ones you see here. And as you self-assess the questions of this assessment, you'll then be given scores around each of the areas: promotion, prevention, early intervention, skilled support, and mental health advocacy. Now, what you can see on this form is you'll get a minimum score, which is of all the people who completed the assessment, what was the minimum score that was given to a question? Let's say for this one, it was a 2 for promotion. One of the questions, it was given a 2. And the maximum score was a 4. So what that will then do is it will give an averaged out score, a total score, and it will also give a stability score. The stability score is essentially the gap between the minimum and the maximum. And it shows you how stable the culture actually is in this area of your workplace. The greater the stability, the lower the variance in responses to each of the questions in this area. So for example, in the prevention area, you can see there's a stability of 100%. There was no variance. People were in agreement to each of the questions in prevention. So you can rely on the score there. But if you look at early intervention, you've got a score of 1 and also a score of 5. And what that's suggesting there is you can't necessarily go off the overall score, because there are people in certain areas that are suggesting a lot more work needs to happen in that space. So this is an assessment. It's an awareness tool. We're offering a free complimentary consult session to actually help you unpack the results of this survey once you've completed it. And when you do complete it, you'll be sent your report along with a link that you can use to book in some time and actually go through this and then discuss the strategies and solutions to implementing frameworks around psychosocial risk and mental health. Okay, now, one thing about this risk assessment itself that we were actually getting asked by a number of people is there's lots of different risk assessments available, and each one of those serves a different purpose. What's really important to understand about ShareTree's risk assessment is that we're really focused on the underlying systems that actually create a culture around mental health. What we're here to measure is not necessarily just the behavioral traits of a team, but the underlying systems and frameworks that provide solutions to challenges that can actually come up. So as an example, if there's an underlying issue where one of the leaders of a team is creating psychological risk for their team members, they're acting abrasively and creating conflict, for example, it's important to identify that behavior. But what actually matters even more so than that is making sure that the workplace has a framework and a system in place to not just identify it, but resolve it as well. So we focus on a solutions-based system, not just identifying the behavioral problem itself. And so as you go through the questions, you'll notice that the solutions themselves are the ones being suggested through these questions. Okay. So I'm going to just check in at this point just to make sure everyone's okay with the risk assessment and what we've gone through. Does anyone have any questions based on this? Cool. Okay, so let's move on. This is really a contemplation question, which is what are the first indicators of mental health risk in your team, in your organization, or any culture that you find yourself in? I'd love to see some ideas and thoughts in the chat. What do you think you first notice when someone is at risk of mental health? Yeah, withdrawal, I agree. I think that's usually one of the very, very first ones. Poor performance, lower effects. Yeah. Seeing someone's performance drop out of the normal range, I think is a really big indicator. Absence from work, yeah, increase in sick days, 100%. Now, the question I want to ask is disengagement. Yeah. At what stage along this journey are we noticing each of these things? At what stage will someone's performance drop? Will they start taking days off work? Will they start withdrawing? Will their personality change? Is it at the very early stages, or have they been sitting in their struggle for a period of time and it's actually gotten to a point where now you're noticing the signs? Usually much later, slightly later, towards the later stages, sitting with it. Yeah, exactly. And so, how do we actually notice the early signs before those fairly obvious symptoms start to show up? How can we take a far more preventative approach, an early intervention approach? So I'm going to do for those who are willing, I'm going to do a quick activity, which is for those of you who have your cameras on, and if you want to turn your cameras on, that would be great as well. But I want you to just look at the faces of the people you can see. And I want you to try to guess internally where their emotional state might be lying. And there's many more emotions than these four, but just to keep it very simple, where do you think the average of this room might be today? Yellow, okay. Yellow to green. Orange. Okay. How confident are you? So for those of you who are putting those thoughts in, how confident are you that you're kind of on the mark with your guess there? Not confident at all. As confident as you can be just looking at someone. Impossible to say. Yeah, right. And I think that's really the key, which is you can't really tell just by looking at someone. And so that poses a really contemplative question, I think, which is if you can't really tell those very early stages, and by the time someone's actually demonstrating and showing some of the riskier signs, withdrawal, performance decreasing, taking days off from work, how do we fix this? How do we create a framework where we can actually pick up on it far earlier on and create solutions that are much more preventative in their nature? So let's talk about that, and that's really today's purpose, right? Understanding how we can do that and developing strategies and skills and frameworks to help do that. So before we can guess the emotions of others, we probably need to be able to identify our own emotions. So what I want you to do is I want you to kind of place yourself on this linear scale, this horizontal scale of pleasantness. How are you roughly feeling? On a scale of very unpleasant to very, very pleasant, how would you roughly place yourself on this scale? Oh, cool. I didn't realize people can annotate. That's handy. Yeah, over there. Slightly to the right of halfway. Okay, yeah, somewhere around here. Let's try naming them now. What are some examples of unpleasant emotions? When you do feel unpleasant, what are some words that we can use to capture those states? Crap. Tired, angry, anxious, afraid, sad, depressed, confused. Yeah, we probably don't have time to list all of them, but they go on all day, right? There's many of them, and there's just as many on the pleasant side as well. There's so many. But the reality is, we know there's a difference between pleasant state emotions and unpleasant state emotions, but there's also sort of this vertical scale as well of when you are feeling pleasant or unpleasant, there's a state of energy to that emotion. For example, if I said to plot the energy of anger, well, we know feeling angry is not pleasant, it's unpleasant. But is it a low energy emotion or a high energy emotion? Definitely high. Yeah, it's definitely on the higher side. If we were to plot something like sad, is that a high energy emotion or a low energy emotion? Yeah, low. And so this is the array of emotion. This is using two axes of pleasantness and the level of energy that's actually associated to the emotion. Okay. So what we use this framework for is to actually assess where we're feeling first and foremost. But then we want to be able to place other people and to have an understanding of the general culture of our organization and team as well. So, cool. Yeah, we've done the activity. These are a simplified form of the many hundreds and thousands of emotions that potentially exist. These are 16 of them that really guide us into placing ourselves and where we feel we are at any given point in time. Okay. The other thing about these emotions is that it's really important we don't overlabel emotions as good and bad. I used to definitely have a tendency to see things as good. I'm feeling good today. No, I'm not feeling good today. I'm feeling bad today. And I think that's very common language in our culture as well, right? And I think what that does is we really start to, maybe shame is a strong word, but we really start to put down the way we feel instead of placing a lens of understanding and trying to empathize with the way that we're actually feeling. So the framework we've got here is there's different zones. And inevitably, you will find yourself at different stages of the year or your life. You'll find yourself in all stages. And what matters is actually that there's strategy around how to navigate the different zones. And there's an understanding of what that zones what's capable in those zones and what type of support you might want to look for in those states as well. So the performance zone, that's high energy, pleasant states. When I feel happy and engaged, ecstatic, or even excited, I want to do. I want to engage in something. I want to act in something. I've got energy to give and I want to give it. When I'm feeling pleasant, but I'm low in energy, for me, it's a very reflective time. I personally like to be more inclusive, more internal is a better word. And I like to spend more time with myself. I am more contemplative. I find it's a good time to get creative. When I'm feeling behind, we start to enter the survival zone over here, is what we call it. Begins with strain, but it can enter overwhelm, anger, and even enrage. We will find ourselves in this zone every now and then. And this is where being aware of that and understanding that is how we navigate support for ourselves. And the burnout zone is exactly what it sounds like. This is where a lot of crisis is birthed from, states of anxiety, depression. They exist in this zone here. Spending too long without good well-being practices and good skilled support around us is where mental health strain can really start to escalate. Okay. Let's move on. Okay, so how do I remove this annotation? Thanks, whoever did that. Okay, so yeah, basically to wrap things up now, we are just going to talk about the technology ShareTree leverages in delivering its support frameworks. So the framework I went through before about the emotions is we have a technology and an app called Emotional Pulse. For self-awareness, I check in with myself every single day. We are able to create trusted pairs with people you know and you trust to share your state so that they can celebrate your pleasant states and they can support the challenges and the strains. And then there's anonymous, confidential team mental health support as well. What we encourage with all the organizations we work with is to have 2 questions for every weekly team meeting using this technology. And it's to open the conversation and invite vulnerability by asking what's been most challenging and also what's been the learning or something you're grateful for. Okay, so I'm mindful of time. So I'm going to hand it off to Reese in a moment. But what I wanted to really end on is if you connected with what we went through today, I want to invite all of you to become one of 2 things. And it's either way is to become an advocate for these mental health frameworks. You can do that by becoming a certified mental health first responder yourself. The mental health first responder training uses the ISO standards, WorkSafe standards, and you'll be certified and skilled to handle the challenges and strains of mental health for yourself, your peers, and your team and your workplace. But also, we'd love for you to become an advocate for your workplace as well. And what we can do is we can help provide these solution-oriented frameworks in your workplace or your community. So if you scan that QR code, you'll be taken to a form just to provide some information, and then we'll have a conversation with you. We'll look to understand what it is you're best equipped to engage with, and we'll support you in that training or engaging your workplace as well. So any questions before we hand off to Reese, who's going to go through amazing training? Okay. Don't think there's any questions. All right, so that's the end of this introductory session. Reese is going to take us through a really amazing training for the LIFT practice, which is the first part of the mental health first responder training. You're all more than welcome to stay for that. I really encourage you to. So Reese, over to you.
Thank you, Shanika. And thanks for everyone joining. Also, thanks to Brianna for that presentation on where we're at currently in workplaces with those kind of claims and mitigation. So I found that quite interesting to see someone talk who's plugged into the pulse. So yeah, just to reiterate, the next 2 hours will be practical LIFT training, which is part 1 of 2 sets of training modules that cover what it is to be a mental health first responder. I'll speak more to it briefly, but we're all on Zoom. It's after work hours, at least here in Australia. So I call for a 5-minute bio break and then we can come back fresh for the next couple of hours. Look, I'm going to try and rein it in before 8. No promises, but obviously, exercise self-care. If you need to bail, you got to do that. But see you all back here in 5 minutes.